and you kind of a thought leader of our industry, I would like to know about new ideas and trends in sleep medicine now.
Thank you for asking, Maria. That's a great question. I love to think about this because in the early days of sleep medicine, people had to be diagnosed in hospitals with 20 little connectors all over their bodies and watched by a specially trained technologist. Nowadays, the understanding of how badly somebody is breathing and how it's affecting their body can be contained in a wristwatch or a ring or a little tablets taped to a finger. So the diagnosis, that the evaluation of how the human is behaving through the nighttime is getting easier. Well, at the same time, there's not so many sleep physicians that are specially trained to recognize all these problems, but there's 200,000 of us. And so the trend is that using the easier to accumulate measurements of how people are breathing and sleeping is being put in the hands of lesser trained healthcare providers. We don't need everybody to see a sleep physician when other physicians, ARNPs, and specially trained dentists can handle some of the easier things because of how simple it is to figure out what's going on. So what are the trends? The trends are moving away from a singular specialist into a group of healthcare providers that can have a true impact on community health. And we're a big part of that.
No, I really love, because that's a major concept of this channel, is to make the gap between medicine and dentistry smaller.
Yeah.
And what's kind of, for me, I've been doing it for the last 12 years, and how I was trained, and we look at a very standardized picture of overweight, middle-aged men who have sleep apnea. And when I start doing the cases, that's totally not true. And I absolutely love the idea what you put in a magazine, it's totally different tendency now. It's so much more comprehensive and looking at the whole population, because females are suffer from sleep apnea as well, and little kids and all of that. And your dental sleep practice magazine bring technology and digital and different approach, and I would like to talk more about that. I want to mention, with other dentists and dentists who treat sleep the same way, we're very isolated. We stay in our little offices taking care about the patients, and only the organizational dentistry, like American Dental Association, that's the biggest organization what kind of put us together, can educate us better. Please tell us about that significant work what you did for American Dental Association, and how like a new look of the dentist, what we have to do now.
Yeah. Well, the ADA is, it's a trade group of us. It's a trade group of dentists, but they've always had an outlook of what can dentists do for the community, for community health. That's how fluoride came to be, is trying to reduce the impact of caries, for example. And now what they've realized is that dentists have an ability to have a big impact on overall health by watching for oral health trends. Everything from HIV to HPV to periodontal disease affecting heart disease. And now, how does breathing and sleep affect the whole person that's sitting in a dental chair? And with the ability we have of thinking preventatively and also seeing our patients so frequently and also having so many of us, then the ADA has recognized that dentists can have a big impact, getting closer to a primary care physician's role, in that we're helping our patients with a kind of the fundamentals of health. And we're claiming that space. A couple of years ago, 2017, the ADA, that's 5 years ago now, the ADA said that we need to be screening for sleep-related breathing disorders and doing something about it. If we do find that, referring them for diagnosis, managing them along with a physician, doing the testing, and powerfully, they talked about how our role in treating children can be so important, because in adults, when adults come in and they don't breathe well, they snore, they have some problems. we can help manage those issues. But and there's ways to fix it too. And I know we're going to talk about that in a second. But in little kids, the most important thing that dentists can do for general health of the population going forward is going to be recognizing when a child's airway structure is not growing properly, when their mouth isn't big enough to accommodate their tongue, when the floor of the roof of their mouth is impeding airflow through the nose. If we can recognize those things in a 4 or 5 or 3-year-old and correct those things, and we're the only part of medicine that can do that, then we start children on a pathway towards better health than has ever been started, because nobody's ever paid attention to this. And back when I was that age, they looked at my mouth and said, well, when all your teeth come in, we'll deal with it. We don't think like, lots of us don't think like that anymore.
I'm going to ask you some practical questions. I want to say we appreciate our audience, and please tell us who you are and put your questions in the chat, and please put likes and share. It would benefit a lot of people. We appreciate you. And now I want to ask you the futuristic question. Please tell me why do you think orthodontics is a key to the future? I want you to be, a little bit in more details. I don't want to be too technical, but through my practice, I found a lot of orthodontic tendency, which was done to my sleep apnea patients, actually, make them my patients.
Yeah. Well, the progressive orthodontists these days are recognizing that they were trained in ortho school to have 3 incredibly valuable goals: have a beautiful smile, have a coordinated occlusion, which means a good bite, and make sure the jaw joint, where it hinges all the parts, works well with all of those parts. So those are great goals. People turning out after orthodontic treatment with those 3 things accomplished have a successful outcome until you start thinking about other things. And other things are past the teeth. And the other things are the bone support that allows the teeth to be there. And what my goal, and many of our goals, is to help our orthodontist colleagues recognize that they have the ability to impact the bone support that gives that arch form, that tooth position, that coordinated by that beautiful smile, its whole basis. So if a dentist who sees children, could be an orthodontist, could be a pediatric dentist, recognizes that in a 3-year-old or a 4-year-old, that the upper jaw is not forming wide enough. And so the palate is a deep, narrow palate. My friend Barry Raphael calls it a thumbprint palate, where thumb can fit up in there, but your tongue never could. If it's a thumbprint palate up there, well, that means the palate is encroaching upon nose space. And if the palate's moving up and the nose is getting squished, that child's not going to breathe well. So if we can expand that palate when it's still growing, and it's super easy to do it then, they can push on that little bone up there and make the palate wider and flatter. So it's a tongue-shaped palate, not a thumb-shaped palate. Then the nose gets bigger. And at the same time, we're doing myofunctional therapy to make sure the child is trained to breathe properly and swallow properly and put the tongue in the right place. And then we are now going to end up with a beautiful smile, a coordinated bite, a healthy jaw joint function, and the ability to breathe around a nice, big, open, bony support of the soft tissues that define the upper airway.
No, this is a great answer. But tell me, how, for our listener who not located, in a close proximity, sure. But
so if your child, I got it. If your child is making breathing sounds at nighttime or any time, but especially at nighttime, any breathing sounds, and if they if they're making any breathing sounds, or if they're ever mouth breathing, or if they don't sleep quietly, still, in other words, they can move around a little bit, but they're not thrashing around all night. So if those are signs that they're not breathing well during sleep, then something needs to be looked into. And the first place to go is the pediatrician. Don't be disappointed, parents, if your pediatrician doesn't understand the question very well. But you can also go to your dentist that sees your child and say, can any of these things mean that they're not breathing well at nighttime? And if so, what are we going to do about it? And if the pediatrician or the dentist who sees your child does not answer with an airway thinking, what's good for the long term, how can we make sure that your child is breathing well, has a good open airway, if they don't answer along those terms, they're not keeping up with current events. And so you might suggest a different book, or you go to or find another doctor. But if it's your, especially somebody you like and trust, help them with some resources. Help them with Sharon Moore's book called Sleep Wrecked Kids is an incredible resource. Breath is an incredible resource by James Nestor. And you can The Oxygen Advantage by Patrick McCowan is an incredible resource for breathing patterns. So there's lots of ways that we can help our colleagues move a little forward. And so your parents may not be brave enough to bring that up. But if you entice your parents to give you a report, how was that response when you took your child to the pediatrician? What and to the dentist there? What if they weren't listening? Maybe the dentist who's as zealous about this as I am will pick up the phone and make a cold call and say, "Can I help you with this?" Send them a brochure.
I really appreciate, like, we know now the future trends, and for healthcare providers, I recommend to read your magazine, and it's a newest tendency, and as well as the book. Thank you very much for recommending that. And for our audience, if you have questions to Dr. Carstensen, please put your questions in the chat box, and I will send it, and we will find you the answer. And again, Dr. Carstensen, I would like to introduce you to our audience. Dr. Carstensen has been treating sleep apnea and snoring in Belleville, Washington since 1998. He is consultant for American Dental Association for sleep-related breathing disorders and a head of American Dental Association Children Airway Initiative. He created a wonderful brochure about children airway. He has significant training in different aspects of dentistry, but especially in the sleep. He graduated from mini residency, and he's diplomat of American Academy of Dental Sleep Medicine. And now he lectures internationally and direct sleep education for Airway Technology and Pankey and Spears, and as well as Louisiana State Dental School, which are all very respected institutions, as well as he is advising on a lot of sleep related manufacturers, the products to promote a better night's sleep. And we are very honored to have you here because you're editor of Dental Sleep Practice magazine since 2014, and now you serve as the chief dental editor, and also you are co-author of the book Clinician Handbook for Dental Sleep Medicine.
Yeah, I have that one here. So
yes,
that's what it looks like. Yeah.
And regarding our audience, if you have a question for Dr. Carstensen, please put them in the chat, and we would like to know who you are and where you're coming from. And if you listen to this interview in a recording, please put your questions. We will definitely find you the answers from Dr. Carstensen.